who declares Mpox a global health emergency amid rapid spread in Africa. The World Health Organization, WHO, has issued its highest level of alert for Mpox, a viral disease that is spreading rapidly across Africa. This marks the second time since 2022 that Mpox has been declared a global health emergency. The WHO's announcement follows a declaration by the Africa Centers for Disease Control and Prevention (CDC) that Mpox is a public health emergency. As of this year, more than 14,000 cases and 524 deaths have been reported in Africa, surpassing last year's figures. The WHO's decision to declare a public health emergency of international concern (PHEIC) was prompted by the emergence of a new variant of Mpox and the detection of cases in several countries for the first time, including Kenya and Rwanda. Mpox, formerly known as monkeypox, is a viral infection that affects both humans and animals. It belongs to the orthopox virus genus, which also includes smallpox. The virus was first identified in monkeys in 1958, and the first human case was reported in the Democratic Republic of Congo in 1970. In 2022, the WHO recommended renaming the disease to Mpox to reduce stigma and its association with monkeys. The virus is transmitted to humans through close contact with infected animals or people. Human-to-human transmission occurs through direct contact with skin lesions, body fluids, or respiratory droplets, as well as through prolonged face-to-face contact or touching contaminated objects. Symptoms of Mpox include fever, headache, muscle aches, and a distinctive rash that can appear on the face, hands, feet, and other parts of the body. The rash eventually forms pustules and scabs before healing. In rare cases, the infection can be fatal. The current outbreak in Africa is being driven by clade 1 of the virus, which is more deadly and harder to detect than the clade 2 variant that spread globally in 2022. The Africa CDC reported that cases in Africa have increased by 160% and deaths by 19% compared to the same period last year. The majority of cases have been reported in Congo, where a new form of the virus that causes milder symptoms and genital lesions has been identified. While there are no approved treatments or vaccines specifically for Mpox, the antiviral drug tecovirimat TPOXX is being studied for its effectiveness against the virus. The smallpox vaccine Jynneos has also been approved for severe Mpox cases in adults, but a significant portion of cases in Congo are in people under 18 who are not eligible for this vaccine. The WHO emergency declaration is intended to mobilize resources and encourage international cooperation to prevent the further spread of Mpox. Health experts warn that if the outbreak continues to spread within Africa, it could pose a global threat.